Hi guys, how you doing? First of all, thank you for landing on my channel. Today's video is about iPRF, which stands for injectable plasma rich fibrin. Now, I use these methods quite frequently in my practice, and today's video is about performing it on hair. There's many different factors why we're thinning, and sometimes can be just hereditary or because there's an hormonal imbalance there, can be stress, there's many different factors, so we can't really point out a reason why we lose the hair or we thinning the hair. But what iPRF does is a method to trying to stimulate follicle regrowth. Sometimes we have a follicle that's a little bit weaker for whatever reason it is. By injecting platelets of rich fibrin, what we do is we just stimulate blood flow, growth factor, and stimulate that weak follicle to come back stronger. I would probably say that obviously it's not a magic treatment. It's something that we normally do within courses, or we do a number of sessions, and it can take up to 5 or 6 months at times if you do it once a month. But generically speaking, it's a great treatment and it does work. Obviously, like any treatments out there, we can never guarantee how your results will be because people react to treatment in different ways. And this is just for any treatment that we do. It can be facial treatment, body treatment, or hair treatment. Expectations, we can perform the treatment at the best of our ability, believing and trusting that the treatment will work phenomenal for you. But sometimes if you react not as well, probably I'm not going to use the word react, if you don't respond as well as others, it's nothing that we have done wrongly, but meaning that you potentially just need a few more sessions. So today's video, I'm going to perform the treatment. I'm going to take you through how I perform the treatment, from taking a little blood, spilling the blood, and extract this lovely platelets, and then re-injecting them where is needed. So hopefully you will enjoy this video. I will appreciate any comment, and obviously if you want to share it, even better. If you want to ask me any question, just put a comment below, and I check the messages constantly, so I'll be very happy to reply to that message straight away. So enjoy the video, and thank you for looking through my video and channel. Bye. So first thing that we do, obviously we prepare this kit to obviously draw the blood. For hair, I tend to take 2 of these, and normally I can get out about 7.5 mil of iPRF, which is good enough to treat most of the actual head. If I've got a patient that needs a little bit more, because obviously the area that I'm treating are probably a little bit bigger, I tend to take 3 tubes. First thing we do, always make sure that the area is absolutely sterile. So we clean it nicely and never to touch this again. We prepare a needle. I love to work with butterfly. So what we do is get the vein, little scratch, 1, 2, 3, flush back, that's it, done. What we do is you leave the needle in there for a second. That's it. Now, normally I always tell my patient 24 hours before they come in to see me to drink plenty of water, and the reason is because more water we've got, and easier and better a blood draw is. So when we do phlebotomy, we always teach that water is essential, so always to tell patients to drink plenty of water before they come in to see us. And if you can keep your diet as well nice for at least 48 hours, meaning it's like not fatty foods and just clean food, it's even better. So your blood is nice and healthy, and the treatment is just a little bit better, that's all. So as I said, today I'm taking two vials over here, and they're gonna be absolutely perfect for today's treatment. My patient is super hydrated, so the blood is coming out beautifully. And then when this is done, we're gonna spin this blood and extract the iPRF. injectable plasma-rich fibrin. Now, so the blood is being taken. So what we do now is that we need to spin this blood to harvest and taking platelets from it. So iPRF is a low spin, right? Low spin and a very short period of time. So mine is 800 to 8 minutes, which is, in my opinion, perfect. So always keep the centrifuge balanced without the tubes. We're gonna close in there and start the spin. So now we've got 8 minutes to harvest the best iPRF we can to treat these hair follicles. So next stage of the treatment, it will literally be injecting. Okay, so the spin is all done. The 8 minutes are gone. So what I do now is, that is what it looks like, and that is actually perfection. So we are going to remove the cap, remove the second. Literally just, we are getting these beautiful platelets. My patient as well, she's super hydrated. So her platelets today, they are phenomenal. So as I predicted, we are having about 6 meals, more or less, 6.5, which is beautiful. Right, so I've got about 6 meals in here, which is beautiful, what I need. Now, I like to work with a smaller needle because it's much better for patient. The patient is way more comfortable with that. And I use a needle which is 8 millimeters, so it's not very long. And I just enjoy that because I feel that I've got more control when I inject the product. The other things I would say is, let's remember that follicles sit on dermal. So you have your epidermal, you've got your dermal, you've got hypodermis, infract, and so on. So the actual bulb, so the actual hair follicle is in the dermal layer. So if you're injecting too deep, you're potentially losing some of the product. So we have to make sure that when we inject it in the right location. So I want to try to put all this beautiful product in the actual active dermis layer, so all the follicle will get the benefit of the growth. So I'm going to start injecting. And what I tend to do is, because we want to make sure that the patient is nice and comfortable, we need to be as slow as we can. There's not need to be aggressive whatsoever. I just inject some of the product right underneath the area that we want to treat, which is right there. And then I just move, and then again, very slowly. There's absolutely no need of being aggressive. More aggressive we are, more the patient feels discomfort, and less enjoyable the treatment will be. So my main thing is always to keep my patient as comfortable as possible, and I do believe that being aggressive with treatment is unnecessary. And this is still, it's quite of painful treatment because we're injecting scalpel. So we have to be mindful that our patient will feel some sort of discomfort, so we need to make sure that if we can do something to make that less painful, why not? So I'm trying to inject not too deep because I wanna stay in the active layer. Go to this side over here. Then again, we're just gonna go right at the front of the hairline. So then again, don't be aggressive, as gentle as you can. There's absolutely no need to be aggressive at all. Today, I'm treating my patient here that has started, she doesn't mind me saying this, her menopause journey. So she has noticed since then her scalp is way drier, and unfortunately she is starting to notice some hair thinning. Maintenance treatment are important throughout. So maybe once or twice a year, you can do some other courses of 2 to 3 sessions. Okay, so I got nearly the end of the treatment now. This is my last injection there. That's it. Now what you can see, so that is done. What you can see over here, there's a slight little bit of redness all around the area that we treated. So right here, we treated all this lovely area right there and all the area right here. So my patient will come back again in a month, and then we have a cycle of 6 sessions once a month, and this should really give my patient fantastic results. So the aim is to improve the growth of all this area here that is starting to thin through the initial menopause stage that my patient is experiencing. So with these 6 sessions, I believe that we could get some good results. Hi guys, this is the end of the video. I really hope you enjoyed it. Now, what is very important, number one thing to do when you're going to have the treatment done is that you have a good hydration, so drink a lot of water 24 hours before the actual treatment, and make sure that your diet is on point. So no fatty food 24 to 48 hours before you're going to get your blood done. Secondly, what is the aftercare? So the most important things in the aftercare is that you keep the area nice and clean, and I would avoid washing your hair for 2 days after the procedure. So not washing the hair for 2 days, let the plasma do the job, and most importantly, keep the area nice and clean. So I hope you enjoyed this video, and if you did enjoy the video, please do comment below, and I would love to hear what you guys have got to say. See you later, bye!